Good morning. It's Saturday, August 8th, and the virus, the COVID-19 pandemic, has turned the world upside down, but nowhere worse than in the United States. Not only does the U.S. have the highest number of cases and deaths, the U.S. population is suffering more mental health issues than anywhere else in the world. As of yesterday, we had almost 5 million cases and over 162,000 deaths. Americans had the highest percentage. 33% of the people reporting were experiencing mental stress, anxiety, and great sadness that was difficult to cope with. The countries that were next highest were Canada and the UK. I find it strange that the leading countries are the English-speaking countries. What studies have shown is that even before the pandemic, Americans tended to lead the world in emotional and mental distress. I wonder why. Maybe it's in our genes. The experts think that we are doing worse when compared to other countries because we don't have a universal health care plan. Our primary care sources are not really trusted. Our social support system was not up to par, and our leadership response was piss poor, according to the authors of the report. The effective leaders in other countries use clear and consistent messaging based upon scientific evidence and the advice of experts. Bottom line was that American adults were least likely of all countries to get mental health care if they felt they wanted it or needed it. I can understand that situation. Here you have people who are physically sick and dying, and you have somebody who is got a mental health problem. I would think the physical illness is going to take precedent. And how many mental health professionals do we have out there to take care of an overwhelming epidemic of mental health issues? I think it's a really difficult situation to cope with. And just think about all the social services organizations that are probably locked down. Those people probably had to stay home. I don't even know that they were considered essential workers. A lot of distress was caused by economics. And this factor was much higher in the U.S. than in other countries. Almost 60% of the people who were suffering some kind of mental health issues were blaming it on the economic consequences of the pandemic. And with respect to economics, Americans had the lowest opinions of their government's pandemic response. Now, we gave them $600 a week and we did other things, but apparently that wasn't good enough for the general population. And now we're still fighting over the second stimulus package. When you compare the number of people who were satisfied with the national response, we got a 33%, but in Germany, they got a 94%. How come? You can draw your own conclusions to that question. In one area, there was agreement in all countries. The healthcare professionals performed their duties well above any expectations that you could put upon them. In every country that responded to the survey, the hospitals, the nurses, and the doctors got ratings of good to very good to beyond good. In 85% of the cases, the ratings were higher than anything you could expect. Anyhow, getting back to the mental health issues. I think there's a couple of things that we could do that would probably lessen the burden of our mental health issues. One of the big things would be some kind of universal health care that's cost-effective and efficient. Something like Medicare for all, but it has to be tailored differently than the way the politicians think of it and the way it's the money we spent on it. We're spending a lot of money on insurance. Companies are paying huge fees to private insurance companies. And I'm sure if we had some people who could think outside the box, they could solve that problem. So we have many Americans who are underinsured. meaning that they can be exposed to high out-of-pocket expenses or surprise billing. And in the economic situation they're in most of their lives, that's a very stressful situation. So in countries that have universal support, they don't have that worry. According to the survey also that the primary care people in countries where there's universal support have more time to give to their patients. If you notice that in this country, if you go in to see somebody, you get a limited time visit. You don't get a chance to, the doctor doesn't take the time to sit down and talk to you. I think that a lot of that is governed by the number of minutes they're kind of allowed. So I think nowadays there are very few doctors that spend extra time talking to their patients. The other thing is, I'm not so sure that the stigma of mental health problems has gone away in this country. I still think there are many people that are ashamed of the anxieties that they carry around with them. And they're not ready to talk to a lot of people about those things. So that's another issue I think that we have to face within this country. And maybe that's tied to the fact that, going to a psychiatrist or a psychologist costs you a lot of money. And maybe a lot of those things are not necessarily covered by a lot of insurance companies. So the bottom line is, I think a lot of the problems that we have in this country because of our mental health is based upon our economic system. When most people in this country are not making an awful lot of money, we probably still have some strange ideas about how people will view us if we have a mental problem. I think mental illness is still a very misunderstood illness in this country. So right now, the bottom line is the pandemic is affecting our lives in many, many ways, and it doesn't seem to be getting any better. So I'll leave you with this thought. Stay safe, wear a mask. Don't be in a rush to send your kids or grandkids off to school. We have to ride this thing out sensibly. I'll see you tomorrow. Bye.